Aloha, I'm Dr. Sean Delaney with Kalani Total Health Center. Excuse me there. Today we're going to still talk about dealing with TMJ. If you're a person out there that is dealing with the TMJ issue, you realize and you know how painful it can be. Now, for those of us that don't have a TMJ issues, we don't realize how much we open and close our mouth or use those muscles of mastication. Some things that we can consider to do when we're at home or non-clinical treatments are taking an over-the-counter medication to help try to alleviate the pain and inflammation, wearing a mouth guard, especially at night while we're sleeping to decrease our teeth grinding, or clenching down really hard on our jaw or our mouth while we're sleeping. And another easy thing to do at home is using ice and heat directly onto the side of the face or the side of the jaw where the pain is most likely at. Now, those are some things that could help. Those are easy, quick and easy. But here's some things that you have to do. These are like must-dos if you are dealing with a TMJ issue. And the first one being is you got to stop eating hard or really solid foods. You got to get onto a softer food diet. You're asking me, what is softer foods? Why that? Well, eating softer foods allows your jaw muscles and your jaw, the TMJ joint itself, to relax a little bit and not work as hard, giving it a chance to recover and start healing. Some things you definitely want to avoid are chewing gum, biting your nails, even crunching down on ice or biting your lower lip. Those are all things that really screw up and overwork the muscles as well as affect the joint and how it is performing. Some of these softer foods include easy things like soup, cottage cheese, mashed potatoes, we're talking scrambled eggs, steamed vegetables, even some of the fishes, nice baked fish. Those are just some examples of softer foods. So we want to try to, like I said, get away from the solid food and move towards a softer food diet while we're experiencing the pain and allowing the TMJ to heal up. Some other things you definitely want to avoid when it comes to food are certain meats, especially the chewy meats, like steak, for instance. You want to definitely try to avoid not baked, but like bagels or other types of chewy products like gummy bears and stuff. But things that you just chew, it's just going to overwork the muscles, like we said, like with chewing gum. And like we already said, ice, obviously you don't want to be crunching down on really hard things, trying to break them with your teeth, because it's just going to add to the problem and cause more pain and more inflammation, which is going to take even longer to heal. Another thing that's important that you must start doing if you have a TMJ issue when you do have to chew is try to chew your food evenly on both sides of your mouth at the same time. That way you're starting to work the muscles equally, as well as putting the same type of pressure down when you chew and not overworking one side versus the other. If that is a little too uncomfortable for you and you really prefer chewing on one side, try to alternate sides when you're eating, maybe 4 or 5 chews on one side and then switch to the other side of your mouth for 4 or 5 chews. Those are just some things that I would suggest you start doing if you have a TMJ issue. But more importantly, if you are experiencing jaw pain, a TMJ issue, you're just not sure what's going on, give us a call, schedule an appointment, come on down. We would love to give you an evaluation and try to help you figure out what the root cause of your problem is and get you on that path to optimal health. I'm Dr. Sean Delaney with Kalani Total Health Center, your one-stop holistic health shop. Mahalo.